What's going on YouTube? Tony Maritato, licensed physical therapist here. And in this video, I want to talk to you about using one of my favorite devices to reduce swelling and reduce pain after a total knee replacement. So you guys have seen this on my channel multiple times. It's a simple rolling pin. And there's a couple ways to do this. So assuming that we're dealing with a right total knee replacement, I'm hanging out on the couch. I keep my rolling pin available because I know how easy it is to get wrapped up in the day-to-day of recovery. You've got physical therapy appointments. You've got all of these different things you're trying to remember. And before you know it, 2-3 days will pass and you won't have used the rolling pin to massage the leg. So keep it out, keep it somewhere where you can see it. And basically what we're going to do is we're going to do it a couple of ways. If you have the extension to allow you to sit back and elevate the leg in this position, using the rolling pin to create a negative pressure. In other words, I'm bringing the fluid back from the knee up into the system. I usually apply downward pressure and upward pressure. I can work the top, the inside, the outside. If you have staples closing the incision, you don't want to roll over the staples, but any other form of closure, you're generally safe to kind of apply a little bit of pressure at the very top of the incision if needed. And so I'll spend about 2 minutes working through this area. Once I've created a little bit of a negative pressure to move some of the lymphatic drainage and fluid back into the system, then what I'll do is I'll bend the knee to tolerance and I'll work on the lower leg. So the calf muscle is going to go through a lot of soreness, a lot of stiffness. You can spend some time again swiping with pressure up toward the knee because then it's going to work its way back into the lymphatic system and drainage. I can work the outside of the lower leg. So the peroneal muscles usually get sore. There's no benefit to massaging the shin bone itself, but working on the inside and working on the outside certainly is going to help reduce some of that sensitivity. Now, if you're looking for a secondary way to reduce some of the swelling, when we talk about elevation, so something like this helps modestly, but the way you really need to elevate the legs so that you reduce swelling is to spin around and at minimum, get the leg up higher than the level of the heart, or you would have the leg on the back of the couch. So I know I'm flipping around a whole bunch of times trying to make it so that you guys can see. But basically in this position, what I've got is I've got the surgical leg up on the back of the couch. It's about 30 to 45 degrees of hip flexion. Now this is really going to help to allow some of that fluid to come down. Certainly I can sit here, I can relax. I've got a TV up on the wall behind you. And this might be where I spend 20 to 30 minutes after I've done my therapy exercises at home, just allowing some of that drainage to, again, move the fluid back into the system, allow the kidneys to process the fluid, take the waste products out. And as a result, less swelling potentially could mean less pain and better mobility. So if you're looking for ways to reduce pain, reduce swelling, improve function, these are my two favorite. Rolling pin massage, 2 to 3 minutes, multiple times a day, and then episodes of having the leg elevated above the level of the heart, 10 to 20 minutes at a time. Let me know how it works for you. Talk to your physical therapist about performing any of the things that I advise, because you really need somebody who's invested and understands your particular situation. Guys, I'll catch you next time.